We have a series of videos on common practical procedures in the Children's Emergency Department, so I hope you enjoy. In this video, Lucy Bridges, our oncology clinical nurse specialist, will show us how to access a portacath.
So for the port access, we just need to use an aseptic non-touch technique. We need a 10ml syringe to test patency, and our 10ml flush. We usually use an IV 3000 dressing unless the patient has any allergies. We use the ChloroPrep wand to clean the skin. As it's aseptic non-touch technique, we can leave that in the outer packaging. These are the safety port needles. They come in different sizes. So this is a 1 inch. Some patients might have a 0.75 inch, some patients might have a 1.5 inch. It is always important to put a BioNectar or Smart Sight on the end of your port needle because it then provides you with a closed circuit. We always prime our needles before inserting with our saline. This is so if we need to flush, there's no air within the line. To access the port, the first thing you want is for the patient to be in a comfortable position with their back flat against a hard surface. The first thing we do is just have a feel of around the port area to locate the port. Once we've located the port, we take our ChloroPrep wand, pierce the wings, and let the liquid soak down into the sponge. We clean the area, going in different directions, applying some pressure, and we wait for it to dry. Once the area has dried, that means that it's disinfected. So you go back to the port. How I do it is I hold my non-dominant hand, I hold with 3 fingers. I then use my dominant hand to access with the needle. So we take the sheath off of the needle. We hold the port as securely as we can. And then we go into the middle of the port at a 90-degree angle. You keep pushing until you feel you've hit the back. Once we've done this, usually we check the patency before we pop any dressing on. So we take one of our wipes, clean the end for 30 seconds. We take our empty syringe, once the hub is dry, attach, unclamp, and then draw back. Once we're happy we've had good flow, we will flush with saline, clamp whilst we're flushing, and then we will pop our dressing over the top. Sometimes we use the steri strip to make a little loop. So if it gets pulled, then there's less risk of it being pulled out. And then it's ready to use. The portacath isn't bleeding back, so a couple of things that we can look at is the positioning of the patient. If they are looking down at the portacath site, the chances are that they are actually kinking the line in their vein. So what the best thing to do is get them to look to the opposite direction. So if their portacath's on the left side, getting them to look up to the right corner and away from the portacath side. And if that doesn't work, you can give it a clean and you can give it a small flash. If you're not really feeling any resistance, then you can give it up to 5 mils and then draw back to see if that makes any difference. If you are feeling a lot of resistance when you're trying to flush, or you're flushing and you're seeing swelling around the entry site of the port needle, then you must stop and seek further assistance.